The term aseptic technique describes a collection of practices and standards used by medical professionals to stop the spread of pathogens, germs that can cause diseases. This method is essential for preserving sterility throughout medical procedures, which lowers the chance of infection for patients. Eliminating pathogens completely is the main objective, particularly in circumstances where patients may be most vulnerable, including during invasive procedures or surgeries. Disinfection. It is a chemical and physical process to eliminate harmful bacteria, preventing the spread of infectious diseases, especially in susceptible environments like laboratories, healthcare facilities, and public spaces. Regular disinfection includes wiping countertops and other high-touch surfaces. The hand washing. A frequent vector for the spread of germs is the hand. Although our hands are home to healthy bacteria, they can also harbor dangerous infections that can lead to disease. Touch can easily spread these diseases from one person to another or from one surface to another. This highlights how important it is to wash your hands frequently in order to avoid getting sick. Hand washing techniques includes palm to palm, back of the hand, finger interlace, knuckles to knuckles, fingertips to palm, wrist to wrist and forearm to forearm. Keeping in mind the 5 moments. Before touching a patient. Before a procedure. After a procedure or exposure to body fluids. After touching a patient. After touching a patient's surroundings. Personal protective equipments. The gowning. In healthcare settings, personal protective equipment, or PPE, is essential for preventing the spread of infectious diseases to patients and healthcare staff. Medical gowns are crucial for creating a barrier against viruses that could be found in human fluids or other potentially infectious materials. Personal protective equipments. The gloving. Gloves are a critical component of personal protective equipment, PPE, used in various settings, particularly in healthcare and laboratory environments. They serve as a barrier between the skin and potentially harmful substances, including infectious agents, chemicals, and biological materials. Common types are the nitrile gloves or the working gloves and the sterile gloves for maintaining sterility, particularly in surgical-related procedures.